Here are my note cards, and this is my audience. I'm Addison Swisher, and I'm a senior at DeKalb County High School, and this is my informational speech over understanding anxiety. So I'm sure we all can relate to the nervous feeling that we get when standing in front of a big crowd, your heart racing, your palms sweating, and your thoughts racing. For some, this feeling is brief and only happens when doing school projects or participating in big meetings. But for others, this feeling is constant, and this feeling affects millions. This is known as anxiety. So what is anxiety? Anxiety is a natural response to stress. The American Psychological Association describes anxiety as an emotion characterized by feelings of tension, worried thoughts, and physical changes like increase in blood pressure. So now that we know what anxiety is, let's talk about the different types of anxiety that people face. There's generalized anxiety disorder, social anxiety, panic disorder, and there are also certain phobias that can induce anxiety to happen. Although all of these different types share the same symptoms, such as excessive worry or fear, each type of anxiety affects people differently. Now I'm going to talk about the causes and triggers that anxiety has. So there is not one specific single cause. Anxiety is a mix of biological and psychological factors that cause it. Mayo Clinic describes anxiety disorders to be linked to genetics, your brain chemistry, and life experiences that just happen. Imbalances in brain chemistry like serotonin and dopamine also play a huge role when it comes to anxiety and those that face it. There are also environmental stressors that cause anxiety, such as trauma, bullying, financial pressure, and relationship problems. There are also major life events like graduating, parents' divorce, moving, or even job change that can also cause anxiety to happen in different people. So now that we know what causes anxiety and what can trigger it, let's talk about the effects that anxiety has on us. Anxiety affects both your mind and your body. Physically, your heart may race, you may sweat, shake, and some people even struggle with difficulty to breathe. Mentally, you may feel restlessness, irritable, and trapped in a cycle of worry. The APA reports chronic anxiety to interfere with everyday activities such as sleeping, concentration, and decision making. It also has physical health issues such as high blood pressure and is even noted to cause some digestive problems in people who have it super severely. For many, anxiety can make daily tasks such as a presentation or entering a meeting feel impossible. Recognizing the early stages of anxiety is so important when it comes to managing it. So now we're going to talk about how to manage anxiety. There are tons of different options when it comes to anxiety management, and it really just depends on the type of anxiety you have and what works best for you. Some types of managing it include therapy, medication, and change in your health lifestyle. The National Institute of Mental Health recommends cognitive behavior therapy, which is also called CBT, and it is noted to be one of the most beneficial and effective ways to treat anxiety. It has their patients identify what's causing their anxiety and has them express how they feel, which allows them to be able to find what the anxiety is caused by and learn how to treat it. Medication is also another option that is frequently used, such as antidepressants or anti-anxiety drugs. These medications help alter your brain's chemistry and keep it balanced, so that way it helps when anxiety comes. You also can have a change in your lifestyle, such as exercising more, making sure you get enough sleep, and reducing your caffeine intake. This is known to help many in their anxiety. So to conclude, anxiety is more than just a feeling. It's a complex emotion that affects you both physically and mentally. But now we have learned that it is something that can be maintained. Mayo Clinic also reminds us that anxiety is not a weakness. It's a signal that our body and mind need care. Thank you. Here's my audience one more time.